Hi there, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to be talking to you about knee pain in runners. But before I do, let me introduce myself. My team and I are super passionate about keeping you running. We want to make sure that you are empowered with the knowledge to prevent injury, and then when injury does hit, that you know how to manage your injury best to make sure you can get back to enjoying your running. We hold weekly Q&A sessions where you can ask questions about your injury, pain or training, so please do come along to those. If you can't make it, and they're streamed on Facebook and all other social media platforms, if you can't make it, you can ask questions in advance, we will answer them, and then you can watch the playback. We also have a whole load of exercises, stretches, advice videos on our website, so please do go and check those out. The two that I would recommend that you watch now for starters would be the best exercises for runners and how I can recover, or the best ways of recovering from injury. So please do check those ones out. Now, the vast majority of running injuries, you don't need to stop running. It's more about modification of the injury. However, there are a very small number of running injuries that do require rest, and if you don't rest, then you can end up with life-threatening or limb-threatening issues. So it's really, really important that you get your injury checked out. Nowadays, with modern technology, there's no reason the geography doesn't stop you from seeking expert advice. We do video consultations that work fantastically. We have over 350 five-star reviews, so please do check those out if you want to find out how video consultations work. Best thing to do is to get in touch, email us reception@octopusclinic.com. So let's talk about knee pain in runners. What are the causes and what are my top tips on how to manage each of the different causes? I'm going to use this plastic model of the knee to explain, and I'm going to start with the pains that can be caused by the structures around the outer part of the knee. So the first one is your ITB. It's a super common injury in runners. The ITB is your iliotibial tract, and it runs down from a muscle just at the front side of the hip called your tensor fascia lata, or TFL. It comes from there, runs all the way down the side of your thigh, and then inserts just below the knee on the outer aspect of the knee. So that's where you tend to feel the pain, in that lower outer aspect of the ITB, right over the knee joint. Now, there's numerous different causes of ITB problems, but my top 3 tips on managing ITB pain would be, first of all, to look at your pelvic position. That's because the position of your pelvis has a direct effect on how much you will find that your ITB hurts. And I've had patients in the past who literally just make a very small adjustment to their pelvic position, normally very slightly tipping their tailbone behind them, and that can immediately reduce the symptoms, or in some cases get rid of them. So that's the first thing. Look at your pelvic position, and the exercise that I would suggest for that is called the running man. So go and check that one out. The next thing is not to spend a lot of time trying to roll directly over your ITB or stretch your ITB. That's because we now know that those two things won't give you any long-term recovery, won't enable you to recover long-term from your ITB issue. If you do like foam rolling, then please do foam roll around the outer side of your quads muscles, so more like the thigh muscles themselves, or the hamstring muscles. But you're best off spending time sorting out the position of your pelvis. And my third tip, which is looking at the alignment of your knee and working your hip muscles in a standing position. So lots of people, when they have ITB problems, might well be given exercises to work the muscles on the outer part of the hip, so particularly a muscle called your gluteus medius, and people might be given things like clams or lying on your sides doing opening leg exercises. And actually, much better than that, I would focus on standing exercises that work on not just that muscle in your buttock, but also the whole of the movement pattern, so that standing on one leg doing knee bends with something like the wall ball series. So again, you can go and check out that exercise. Right, what next? Well, your kneecap is a super common area to be injured in runners. So the patellofemoral joint, the patella being the medical word for kneecap, and the femoral joint, so patellofemoral, the femur being the thigh bone. Now you can find that you get pain anywhere around the kneecap, around the front, the sides, the inside, underneath the kneecap, and it can move around. So some people think it's a bit strange that their pain is moving around a bit, but that is actually quite common. So what are my top tips for sorting out the patellofemoral joint? Well, the first one is not to spend ages trying to isolate the muscle on the inside of the knee, which is commonly known, perhaps incorrectly known, as the VMO. So don't do loads and loads of exercises working just that inner part of the knee, and certainly make sure that when you are working your quads muscles, you're instead training the quads muscles with the correct alignment, which will make sure that you load both the inside of the knee and the outside of the knee. Most often, if you turn your knee outwards a little bit, you'll get more load going through that inside part of the quads muscle, comparative to if you let your knee drop inwards. So work on the alignment of things like squats, and make sure when you're doing your squats, make sure that you're working the muscles in the range of motion that's required for running. So in other words, in that sort of fully straightened position and slightly bent position. So doing things like wall squats is great if you're doing quite steep, you're training for hiking, for example, but not so much if you're planning on running a pretty flat marathon or something like that. So work the muscles in that range of motion that you need, and then make sure you work your quads muscles both eccentrically and concentrically. What on earth is she talking about, you may ask? Well, concentrically is when you shorten a muscle to contract it, and eccentric muscle contraction is when you lengthen a muscle. So the quickest way to describe it is if you stand up from sitting, you're using your quads muscles concentrically, and as you lower yourself down in a controlled way, you're lengthening your quads muscles and working them eccentrically. So you're best off doing things like exercises stepping down, as well as things like exercises stepping up. So my next most common knee injury in runners is the patella tendon or the quads tendon. So your patella tendon is the tendon here that comes from the bottom of your kneecap and inserts into the bony bit in your tibia there. And then your quads tendon is the tendon around the top of the kneecap, where the quads insert into the kneecap. Now, my top tips with those are not to go overboard with quad stretching. We now know that stretching tendons probably doesn't do it any favours and may actually make them worse. So I would really go easy on your quads stretching. So in other words, that exercise where you take your heel to your bum and you hold it there for a prolonged period of time, go easy on that. And instead what you want to do is you want to do an incremental loading program. So what that means is you want to just build up, start with doing things like squats or single knee bends, that kind of thing, but just to build up in small, steady increments. So those are my first two tips. My third tip with the patella tendon is to start with nice static contractions of your quads muscles, and then slowly add a bit of movement, then add more load, so for example weights, and then add speed, or a combination of those to slowly but surely get you back to running. Okay, next one, fat pads. So fat pads sit either side of the tendon here. You can feel them, the sort of podgy bits at the front of the knee, and they tend to be sore when you fully straighten your knee, because when you fully straighten your knee, those fat pads get a bit of a squish. So the way that they become sore is particularly if you're going into uncontrolled or you extending your knee, so you're straightening your knee in an uncontrolled way. For example, particularly if people's knees hyperextend, so you have particularly bendy knees and the knees extend fast into that position, you're going to be irritating the fat pads. So it's best that temporarily you make sure that you don't fully straighten your knees when you're running. So you reel back that in and you actively think about keeping your knees very, very slightly bent. And then you slowly but surely reintroduce that. Now, before you reintroduce it, it's really important that you gain the strength and control over that range of motion. So that you do mini squats, single knee bends, that kind of thing, in that movement that involves slightly bending and fully straightening your knee, so that you're really getting the control there. Okay, next one, I'm going to talk a little bit, one more on the outside. Down the back of your leg, you can feel your tendons of your hamstrings, the muscles that go down the back of the thigh, and those can become an issue too. Less commonly in runners, but it is possible. And again, a bit like the quads and the patella tendon, it's all about creating a incremental loading program for those tendons. Now, if we open up the knee joint, so I'll take off the patella tendon here and open up the knee joint. So there are all sorts of structures inside the knee that can cause knee pain in runners. You've got your meniscus that for some bizarre reason on this model are blue. So you've got your meniscus, which are the moon-shaped cartilages that sit on the bottom on the femur here. And then over the surface of your femur, so your thigh bone there, you have cartilage. You also have, you can see in here, you have tendons. You've got your ACL, sorry, not tendons, ligaments. You have your ACL, your PCL, your medial collateral ligament, and your lateral collateral ligament. Your lateral collateral ligaments. You also have other structures that you can't see in here. Now, there are obviously different ways of diagnosing all those different bits and bobs, but just to be very generic about it, the best thing that you can do for any kind of damage to the structures inside the knee is to strengthen around the knee. So, for example, something like arthritis, where you have a bit of wear and tear of the cartilage and other structures and various changes inside the knee joint. The best thing is to strengthen the muscles of your quads that pass over the front of the knee, the hamstrings that pass over the back of the knee, but also strengthen the muscles in the foot, the hip, to get that alignment right. And that goes with all knee problems. So it's really important with any kind of knee issue that you look at the stability of the foot and the ankle and the stability of the hip, and you look at the function of the way that foot and ankle is moving and the hip is moving as well. So it's important that you do the exercises like squats and split squats, lunges, those kind of things with the right alignment to make sure that you're spreading the load through the muscles and the various different structures of the knee. So do go and check out how to do things like squats and split squats on our website, and you'll see what I mean by alignment. Last but not least, there's loads of other different causes of knee pain in runners. You've got structures like your pes annurinus tendon, you've got referred pain from the hip or the back. So it's really important never to just presume that because your friend had knee pain and therefore and it was diagnosed as patellofemoral joint issue, to presume that just because they had that, that's what you've got too. So please do try and make sure that you get a diagnosis. I would recommend that you get in touch with us on reception@octopusclinic.com. We can do video consultations, so geography is no barrier to treatment, and we can give you a diagnosis and get you on track with the right exercises and management plan. I hope that's been helpful. Please do let me know what you'd like me to do a video on next, and in the meantime, happy running. Bye.